I make the connection with the patients themselves just by, I think, because I'm a mom and a doctor. And so when I approach a child, I'm approaching them from that aspect of how a child wants to be approached. And then with the parents, I approach them as a co-parent, as another parent, but one with medical expertise to try and make sure they know that I know what I'm doing and I'm gonna take care of their child exactly the way I would expect my child to be taken care of. And that's a commitment I make to them. Nothing happens to their child that I wouldn't let happen to my own child. Becoming chief here at Joe DiMaggio Division of Pediatric Surgery for me was a major personal accomplishment. I don't think you can put into words the benefit to the community of having the resource that they have in Joe DiMaggio Children's Hospital. I mean, we are really truly able to take care of kids from the time that they're just a thought in their parents' mind as fetuses, all the way through and bridging them through to adult programs. Appendicitis, hernias, but we also take care of congenital newborn conditions, bowel blockages that babies are born with, or problems with the nerves in their intestines that they're born with, all the way up through traumas and cancers that kids have. So we do the full gamut, chest wall deformities, and one of my main interests is young women's health as well. One of the really exciting developments that we have at Joe DiMaggio is the development of a young women's center to be able to serve girls and young women who have ovarian masses or breast masses and problems with their period or menstruation or what have you. Really a group of young women who were really underserved. What excites me about the future of pediatric surgery is we're able to do things less invasively. Our thoracoscopic and laparoscopic surgeries, the instruments have only gotten smaller. And then of course moving to fetal surgery, which is really my next goal for the program here, is bringing in that care from prenatal all the way through. We're able to recruit in physicians of extremely high caliber from neurosurgery, ENT, general surgery, cardiothoracic, transplant. We really are able to offer so many unique services so that when kids come here, they can really be taken care of from the beginning through the needs of their care. One of my greatest sources of joy is I have patients many times who will say, gosh, I'm gonna send you something. So, you know what, just send me a picture. And I have so many people who reach out on social media and just send me a note, a picture of their child or a picture of themselves if they're now an adult, and tell me that, how well they're doing and what a difference I made in their lives. And that to me, it's really touching and it's inspiring and gives me energy to keep going forward.